name's Shime. I am an owner and veterinarian here at Brookside Veterinary Hospital. And I'm going to talk to you today about allergies in both dogs and in cats. Allergies are a common reason that we'll see animals come in for itching, ear infections, and most people commonly think of them at the same time of the year that we get our own allergies, which is also true, but we can also see them year round. So allergies are one of the more common reasons, again, that we'll see dogs and cats come in for itching. And there's a lot of different reasons that they have those symptoms. Dogs and cats can be allergic to food. The primary component of food that they're allergic to is the protein source. So chicken, beef, lamb, those tend to be the biggest culprits. They can also be allergic to things in the environment, and that just doesn't mean just outside. That can be inside, dust, mold, things like that. You can have the cleanest house on the market and still potentially have allergens that are exposing your animals. The third thing is a fancy term called atopic dermatitis that basically is just the catch-all for everyone that doesn't fall into those two categories. So they may just be overly itchy, overly sensitive skin, but they don't necessarily come back positive for any specific product that they're allergic to. So what to do when you have an allergic dog? There's a lot of different options. The first is trying to investigate why and where it's coming from. And there's a couple of ways that we'll do that. One is keeping your pet on a flea and tick product year long. Even if we're not seeing fleas, dogs and cats can be bit by a flea and they'll hop right back off and still cause that sort of allergic reaction. And dermatologists will tell you that's one of the first things they'll recommend is getting started on a flea and tick medication because that helps them rule that out as a potential. The second is blood work. We look for any underlying kind of hormonal disorders in the body that might be contributing to skin issues. Thyroid disease is a really big one. And so those are the first places we start. If all that comes back looking pretty good and we've tried those things, then it's digging into what are we truly allergic to. And there's two ways to do that. One is a true allergy test. And that's just for environmental allergens. Unfortunately, there's really no good test for food allergies, blood or otherwise. So when it comes to outdoor allergens or indoor for that matter, there are two tests you can do. One is a blood test that we offer here at Brookside, and it'll come back with a long list of all the different things that your animal's positive for, from molds to weeds to fungus to trees. I had a dog that was allergic to cats. And then they can formulate an allergy, either injection or oral medication that helps to desensitize your pet to those allergens. The other way to do it is to see a dermatologist and actually do a skin test. So it's similar to what they do in people. They give you a micro amount of the allergen and they prick the skin and they look for a reaction on the skin. Some would argue that that's a little bit more sensitive than the blood test, but I've also had many patients do the blood test and the medication work well for them. That's how you would look at investigating any sort of environmental allergen. For food allergens, that one's a little bit harder. The best way to do that is do what we call a diet trial, which is putting the patient on a prescription hypoallergenic diet. Hypoallergenic diet meaning the protein source is either not there or so small that the body doesn't recognize it. And we do that for about 6 to 8 weeks. And just kind of like with a peanut allergy, they cannot have anything outside of that diet because that might skew the results a little bit. So we see how they respond to that, and if they respond well, then that's something we can maintain them on long term. Some dogs do have a combination of both, so food and environmental, so you have to keep that in mind that some patients need the allergy medication on top of a prescription food. But what to do if those aren't options for you, because they can be costly, especially long term, and so the alternative to that is just maintaining and controlling symptoms with different medications. There's two products on the market that are widely used by veterinarians because of their safety. You'll often hear about steroid use, but steroid use isn't ideal to use long term because it can have some pretty significant side effects on the body. So the ones we try to go with are Apoquel, which is a once to twice daily pill that you'll give. And it basically blocks the itch cascade in the body and so helps to control the itch. Of course, it's not addressing the underlying true allergy, but it controls the symptoms, which is what matters. The other is an injection. It's called Cytopoint. Cytopoint is an injection that can be given every 4 to 8 weeks and helps to control symptoms pretty much the same way that the Apoquel does, but a little bit easier administration. There's another medication that I don't have out here that's called cyclosporine. Works a little bit similarly to these ones. And we tend to move towards those if these ones don't work or if we've got a more resistant case. It tends to have a little more side effects than these guys do, so we usually move with these ones first. If you think that your pet is suffering from allergies or you have any further questions about allergies, feel free to contact us and we can point you in the right direction.